Dr. Asif Dhar is the Chief Health Informatics Officer and Principal at Deloitte Consulting. Thank you so much for speaking with me.
Well, thank you for inviting me.
So Deloitte keeps close tabs on the current state of healthcare, whether it's consumerization or the rise of value-based care. And I want to know, how do you keep tabs on such a complex and ever-evolving industry?
Well, we're really fortunate to have clients all over the world and all over the United States, not only in the area of the provider sector or the health plan, but the life sciences and government. And because of the depth and the breadth of all of our client experience, we're hearing everything that's happening. Additionally, because we serve high-tech, telecom, consumer products, we're getting a view of all the disruptions that are happening on a day-to-day basis. A lot of those disruptions are happening because technology is really reaching inflection points. And if you miss that, you're going to miss really what's going to happen to the average consumer in healthcare. Additionally, we have this wonderful place called the Center for Health Solutions that regularly does consumer surveys, analyzes the market. It's a wonderful place that's just focused on really what's happening with healthcare.
So what's something that's come out of that you're particularly proud of?
Well, our consumer survey is always fantastic. We've done a number of really important things about the Medicaid market. We've got this beautiful digital report I would encourage anybody to pick up and take a look at. We've done wonderful work at looking at virtual health and some incredibly provocative thinking on the future of health as well.
That's wonderful. So tell me, what do you think are some of the biggest challenges confronting the healthcare industry right now?
Well, you know, the healthcare starts with health before you get to care. And what we see now is that consumers are being empowered in all areas of their life by disruptive technologies. And it takes a little time for them to catch on. But when they do, you typically have things like network effects, or you have an exponential pace of the technologies, whether miniaturizing or creating, or in terms of their power and performance. If you will, Moore's Law is really catching up in healthcare. And so what we're seeing across the board is this wonderful kind of tipping point where technologies from virtual reality to robotics to the Internet of Things to video and artificial intelligence and data at scale, all converging simultaneously. It's generally when you have a disruption in an industry, you have one or two technologies that disrupt it. For example, a steam engine disrupting the entire way we manufacture, or electricity changing the way we create and move power, or telephones. But those generally happen one at a time. Once in a while, you have this sort of trifecta where suddenly many technologies become available to the industry, and that time is now in healthcare.
That's wonderful. So tell me, how can these technologies help us connect better to our patients? What can they do to bring patients and health systems closer together?
Well, just let me give you a frame of reference. It took about 75 years to fully adopt the telephone. It took about 2 years to fully adopt Instagram. And it took about 2 months for Pokemon Go to have mass adoption. So what we're seeing is the convergence of our physical lives, our digital lives, and our biological lives. And that is what we refer to as the fourth industrial revolution. So it's hitting every industry, and healthcare most particularly. So if you think of the things that motivate you on a day-to-day basis, the great grand challenges of healthcare, you're often not thinking about, hey, am I going to do X, Y, and Z better in a hospital? Sometimes you're thinking about that, but the grand challenges originate with unhealthy communities, right? If people are eating the wrong food, if they're not exercising, if they're not engaging with each other, if they're chronically lonely and depressed, you have communities which generate poor health, which eventually requires care. And what we're seeing is a grand empowerment of our communities. And you're seeing states, for example, start taking on modernization activities of their IT, preparing for this change. You start seeing the massive telecom companies start thinking about what they do next, and the consumer-based computing companies take it on as well. Each of them are turning their sights to healthcare in a new and an intriguing way. For many people, it's a shock that on their wrist on a watch, they can get their heart analyzed and have a one lead effective EKG, check if they have atrial fibrillation. They think that's shocking, but it's not. It's actually been in place for a couple of years. It's been reconstituted as a human experience by Apple and now by other companies. So if you think about it, the technologies have been around, but now what they're doing is that they're being encapsulated in an experience that the consumer can engage with on a day-to-day basis in a way that they want. That's the real experimentation that will change the way we interact and work. I'll give you another small example.
Please.
If you take Weight Watchers as a platform, they're a physical community. It took some work to get there, right? It took some courage to get there too. And it took a lot of courage to be able to explain and discuss your experiences and get on point programs and so on and so forth. It was something that had a linear scale model. You have to build all these, Weight Watcher places all over the world. Then they started automating their point system, so that was the first step in the journey. Then they put it on a smart device. Then they redesigned the way their point system worked. And then they provided a community access portal. Now all of a sudden you have a digital community weaponizing each other around becoming healthier, taking control of their weight, and that community finding a way to combat collectively the problem of obesity and diabetes. That's what's happening in our communities. It's happening a little bit under the surface. We see ripples. We haven't seen tsunamis yet, but a small wave in an ocean, by the time it hits a beach, can become a very massive force.
So you're talking a lot about the kind of solutions that technology brings, but what were the original problems? What was keeping patients from connecting to health systems and connecting to their own health?
Well, when I go around here, or even if I ask myself, so I was trained to become a doctor. I know I should be healthier. I know I should eat right. So it wasn't knowing that made the difference. It's a problem with behavioral science and human psychology. And the role of medicine only dealt with part of that. And as medicine extends into the full weight of health, we're figuring out solutions to that psychology that can actually give us a way to offset the biological computer of our mind. Now we have a tool to fight back that helps us identify psychologically in real time what we want to do that will actually help us with our health. So the challenges tend to be as much psychological and behavioral science as they are technical, as they are about the medicine themselves. And together, the combination of those characteristics is what creates a social intervention.
That's wonderful. That's a very sort of optimistic vision of the future.
Well, there are two views of a future. There's a very dystopian one and there's a very hopeful one. And a path to abundance either creates a great opening in terms of access. So think about it just for a moment. It's not general. When I think about programs of access, one of the programs people start asking me about, well, that's great in cities where there are these wonderful supply channels. Is this going to help rural society? Is this going to help societies in places like sub-Saharan Africa and India and so on and so forth? Think about how hard it is to get vaccines to places where there are no roads. Your starting process is about building a road that could take you tens of millions of dollars and sometimes years just to reach them. With an autonomous refrigerated drones, and they exist now and they're in production now, you can have vaccines sent to workers. You can have those workers send vials of laboratory tests back, and even an iPad or a tablet with data. And so with interventions in the thousands, you can create reach that was completely inaccessible. And that's what we're starting to see. People's psychology is just as inaccessible. Mine was for many, many years. I was very narrowly focused in the jobs I had to do for my clients. I studied a field with incredible ferocity, but it was an unhealthy behavior. And until I had the tools of being able to stand back, pull out, being able to exercise when I need to, eat when I need to, follow up on my appointments when I needed to, you get the idea. I didn't have the psychology, the digital tools, and the medical capabilities that even I needed, despite having gone to medical school. And so that's what we're providing consumers with. And it is a huge change in the way consumers will behave.
That's wonderful. So tell me, what are you most excited to see in 2019?
I'm excited to see that AI is starting to be used not only as an interesting tool, but as an enablement both for consumers and clinicians to get through almost a impossible tsunami of data. So think about it. Your bathroom scale has a number you understand, so you know what to do with. If you got terabytes and terabytes of data as a consumer, what would you do with it? Nothing. You wouldn't have any tool. But if you had AI algorithms that can predict it, for example, do most people know what goes into their credit score? No, but they know to manage it, right? So now that we're having AI tools being able to understand the impacts of health and data, etc., and all of this massive amounts of information, calculate, hey, wait a second, you might want to be nudged here, or you might consider this clinical pathway there. Those tools are being able to empower clinicians and patients and consumers and caregivers and families to think about what they're doing. So the power of AI can not only help process huge amounts of data, it can be a tremendous aid to give us the one thing that we don't have, time. A clinician really suffers from availability of human contact, the sort of engagement we're having now. Being able to look somebody in the eye and say, hey, I care about how you're feeling. I was able to get through all of this information in seconds. I really know that we ought to have a conversation about, if you were talking to me about your weight, and did you exercise? The things that are just hard to do become a lot easier if machines are aiding human beings. And AI has this tremendous capability of not making us more robotic, but giving us the thing that we most desire, which is time, to be empathetic, to be caregivers, to be care receivers. And so that's what I'm most excited about.
So you really see technology as something that enables the doctor-patient relationship rather than something that's going to impede or replace it?
Well, the thing is, I think there's a misnomer that doctors want to do all the administrative activities that they do, and that they don't want to take care of patients. I think that's why they went to medical school. I think it's very difficult, and it's not their fault. It's not the fault of patients, nor is it the fault of science. Information in its own tendency grows exponentially, but we still have 4 years of medical school and 24 hours a day to work. So if we think about it, what we need is time. We need the tools to process so that we can get back to being human. So I don't think it's a replacement. I do think that the future of work changes. I think we do have to have a realistic perspective that our health system is expensive, and we need to think of alternatives. And we need technology to make things easier, more cost effective, give us time so that we can operate at the top of our licenses in whatever fields that we operate in, whether you're a consultant, whether you're an innovator, whether you're a clinician, a nurse practitioner, a pharmacist, you get the whole idea. Whether you're a patient can operate at the top of their license too. The most important link in the entire care journey often are family members caring for people. They're operating at a pretty low portion of their license that they can operate at the top of. So what it does is it gives us the ability to let everyone operate at the top of their license, to redefine the work that's being done, and give us the ability to start interacting humanly again. I'm not saying it's happening entirely now, but that's a mission that we have as a company to help health systems, whether they're day-to-day hospital providers, clinical providers, community providers, help health plans, even life science companies and government health institutions really think about this topic.
So is that where you see healthcare headed in the future, 5 years, 10 years, a gentler, more humane, more connected system?
I think that's a plausible outcome. I think it's a very plausible outcome. But if you notice, most of the things we talked about weren't about the technologies intrinsically being able to do things. I think we're going to reach that point. I think most of us, when I first started talking about things like cloud and AI and Internet of Things and virtual reality, and people look at blockchain, people look at me like, what are you talking about? And it's very, walk through these halls, it's here, right? It's here, it's not the future, it's here now. The question is, how do we restructure our health system? How do we restructure our communities? Think about it at that level. How do we live and breathe and work and wake up and play? Most people I ask, I do this at conferences all the time, I say, how many times have you in the last month gone to a community center? 1 to 10, most people raise their hands. 10 to 20, they almost all go down. 50 to 100, almost nobody. How many of you guys have checked social media in the course of a day more than 20 times? And if they're honest, they all stay up. So we've moved to digital platforms to engage one another. We're pretty good with that as social beings. We're trying to think through the ethics of data and privacy, and those are all good topics. But the interesting thing is we have communities who have already done that. Now we have to figure out how to weaponize each other, how to arm ourselves. Weaponize has a negative connotation, but arm ourselves to take care of each other. Isn't that where this whole thing started? That by being able to care for one another in a more meaningful way, we have the capacity to be able to insulate ourselves from from poor health and disease. And that's where I think we have a choice to make as a society. Is it a fait accompli? Of course it's not, because there's a lot of work to be done. We're not, as a company, our partnership isn't Pollyannish. There's a lot of hard work, and there's a dystopian view of this as well if we don't do it. And so that's why we're so committed in the journey.
You really do have a serious vision for how technology can help us and how it will reshape healthcare. It's refreshing.
Well, we're working on it. We're full speed ahead, and it's not a path when you're as fortunate as we are to have clients all over the world in all aspects of the healthcare system, we look at it as an obligation to think about the future and help our clients get to a place in which there's more abundance, there's more availability, things cost less, you get longevity, you get people being able to have access to healthcare in a more meaningful way. You get clinicians that are able to care for their patients. You get nurses that are totally empowered to practice at the top of their license. Patients who can avoid disease when it's meaningful, identify the right individual personalized treatment, and ideally a cure when it matters most. And communities that can love and care for each other better. If you're seeing that and you know that there's a path, you have an obligation to stand up, and we're taking that obligation seriously.